Hello and welcome to another lesson in your English language studies, and that is on language registers. Okay? Now, language registers is very important. We need to know the exact words that we use in any given situation. That is very important in speech. Okay? So if you are speaking to a lawyer, or you are speaking to a doctor, or if you hear a doctor speaking about his job, or a lawyer is arguing his case, there are so many words that you hear that is completely different from the ones you hear from a teacher. Okay? And that is, they are using registers. Okay? So every walk of life, every domain has its own registers. If you go to the hospitals, you hear words like patients, medicines, diagnose, injection. Those are the kind of words you hear, isn't it? Good. So if you go to school, you hear different set of words or different set of vocabularies. For example, timetable, lessons, pupils, teachers, okay, laboratories, and so on and so forth. Those are the kind of words you often hear. So this is what we mean by registers. Okay, good. Now, here are some examples of registers that are related to education. Okay, now when talking about education, there are some words which are very important or that needs to be known. For example, we have school, okay? School. Now we have what we call public school, and we have private school, you have boarding school, you have nursery school, okay? You have classroom, okay? Classroom is the place where, okay, lessons are conducted, okay, in the classroom. You have desk, okay? You have chalkboard, right? For example, this one, you have chalkboard where teachers write their notes, okay? You have whiteboard, you have marker, okay? You have pen, pencil, chalk. So these are examples of words that we often hear in the school setting or in the area of education, okay? You have teacher, you have pupils, head boy, head girl, register, okay? You have assembly, you have break, okay? School holidays, computer room, you have the gym, okay? The gymnasium, or short form, in short, like gym, playground, library, lecture hall, okay? If you go to universities, also you have some words are often used. You have professor, lecturer, researcher or research, undergraduate, okay? You have graduate, you have postgraduate, master's degree, PhD student, thesis, okay, dissertation, lecture, debate, higher education, semester, student union, tuition fees, university campus. These are often words we hear when you go to universities. You also have, in a school context, in the context of education, you have sit an exam. People sit an exam. Okay, you have essays. You can fail an exam or pass an exam. All right. Study, revise your notes. The curriculum. Talk about the curriculum. Talk about the course. Subjects, grade, mark, exam results, talk about qualifications, certificates, attendance, projector, calculator, book. These are items that are often used, okay, in the area of education. Textbooks, questions, okay, answers, timetable. Sometimes we talk about the punctuality and regularity of students, okay. We talk about discipline in schools, lesson plan, rules, regulations, procedures, assessments, okay? So if you go to the school context, these are the words you often hear. and many other words, okay? These are the vocabulary used, or we call them the registers used in education, okay? In the school environment. Good. So these may be different from the ones you would hear in the context of a hospital, okay? In the context of a hospital, okay? Next slide. Good. Like in the medicine, okay? You hear abnormal, right? If something is abnormal in your body, if you have if you feel some kind of pain in your body, you say it's abnormal. Acute pain, you have an allergy, okay? If you are allergic to certain medicine or certain food, ambulance, amputation, okay? If you lack blood, you say it's anemic, the patient is anemic. If you want to treat bacterial-related disease infections, you use antibiotics. You have antidepressants, you have asthma, kind of a disease. You have bacteria, side effects, okay? If you take medicine, some medicines have side effects. Test results, okay? Test results. Blood donor, is somebody who donates blood to a patient. You have blood pressure, bruises, cesarean section, like operation. Corona, okay? Corona, that is to test the result, the actual cause of somebody's death, okay? You have a critical condition. Now, when patients can be in a critical condition or can also be in a stable condition, okay? Good. So these are the kind of expressions you hear in the hospital setting. You have crutches, right? If somebody cannot walk properly, they are given crutches to support themselves, okay? You have deficiency, means you lack certain things in your body, certain nutrients or certain nutrients in your body. Dehydrate, loss of water. Diagnosis, that is determining what kind of sickness you have. You have specialist, therapy, treatment, discomfort, dislocate. If a particular joint is dislocated in your body, say that is a dislocation. Emergency, okay, family history. Sometimes there are certain sicknesses that are hereditary, okay? So that is why when you go to the hospital, the doctor has to ask you about your family history, okay? Fatal, that means something very serious, a particular, you have a fatal accident or fatal disease. It's very serious, very dangerous. Fever, okay, flu, germ, genetic, okay, that has to do with your genetic makeup. Growth, you have stable condition. Transplant, you can transplant a heart, okay, heart transplant means to, somebody's heart has a problem, okay, it can be, take somebody else's heart and transplant, okay. You can transplant somebody's liver. Heart attack, okay? Heart attack, HIV, illness, immune system, okay? Infant, infection, inflammation, injury, intensive care. Yes, if somebody is in a very critical condition, that person needs intensive care, okay? Lab tests, all right? Stress, unconscious, somebody may fall unconscious. Lab results, if lab tests are done, then the lab results are also shown, brought out. You have life support, life-threatening, malignant, medical school, newborn, that means an infant, a newborn baby. Operating room, okay, that is the ward where operations are conducted. Pain, symptoms, urine samples, okay. Painkiller, if somebody is in pain, they are given painkillers or painkiller tablets or injection. Paralyzed patients, pharmacist, drugstore, physician, poison, prenatal, prescription, routine checkup, okay. Temperature, virus. So these are a whole set of vocabulary, okay, that you often hear when you go to the hospital setup, okay. Now we come to sports, okay. Now these are words that are used in sports in general, okay. We know that there are different kinds of sports, but in general, most of these words are used, be it in soccer, in athletics, and so on. Now you have the arena, okay, you have the amateur, means a beginner, you have an athlete, okay, you have athletics, somebody who is involved in the field and track events, those are called the athletes. The athletics is the particular sport they do. Award, okay, if a particular team or a particular athlete or sportsman, okay, they win awards, okay, they win awards. Beat, in sports, you are beaten, okay. Captain, as the leader of the team, okay, you catch. A ball thrown, you catch it. Champion, okay, that means the winners. Now, spectators cheer on their team, okay. They cheer on their team so that they can raise their spirit in order to win the competition. Coach, okay, the coach takes care of the team. You have to compete, competition, your contest, okay. Court, like a basketball court or a volleyball court, okay. Have the course. You have the cup, okay. You win the cup, like in football, okay. You have the cup. Defeat, you can defeat a team, or a team can defeat your team, okay. Another team can defeat your team. So defeat. Defend, like champions always want to defend their records, always want to defend their trophy, okay. Draw, if neither team wins, that means they draw, okay, or they drew. Event, fan, supporters, the field, you have final score, okay, final score. That is the score line at the end of the game. Fitness, goal, gym, halftime, okay, like in soccer or football, it is divided into two halves. You have the first half and the second half, okay. You have the judge, league, you have leisure, lob, okay. Yes, manager, medal, object, offside, opponent, pass, penalty, performance, physique, pitch, player, practice, professional record, referee, okay, a very important figure in the area of sports, okay. Rules, each game has rules, okay, and players must respect rules, okay. Score, shoot, kill, or skill. Spectator, those are the people watching. Sportsmanship, stadium, strategy, tackle, tactic, talent, teammate. So these are some of the vocabulary, okay, or some of the words that are related to sports, okay. So when you are in the area of sports, these are the words you often hear people use. Or when you are talking to someone who is sport-oriented, these are the kind of words they often use. So that forms the register, okay. All right, registers related to law. If somebody is a legal-minded person, somebody who studies law, when he talks to you or when he is doing his job, these are the kind of words you often hear from them, okay? There is attorney, case, court of law, evidence. Evidence. These are proofs that you bring in order to support your case or your argument. Guilty, okay? If you are guilty of a crime, it means you actually commit the crime. Judge, lawsuit, you file a lawsuit. Lawyer, somebody who argues his client's case. You plead, okay? You plead guilty or not guilty. The judge sentences at the end of the hearing, okay? Yes. Sue, you sue someone to court. The trial, verdict, give the final verdict, okay? Now you acquit, okay? If somebody is put in jail or is finally acquitted, means it is is set free. Now you appeal, all right? If a judge, if you are not happy with the final verdict of the judge, or if with your sentence, you can appeal, okay? Argument, all right? Arrest, allegation, bail lift. You have bar, capital crime, okay? You have complainant, confess. If you confess to a crime, it means you actually admit that you are the person who did what you are being accused of. You confess. Constitution, okay? You have criminal, cross-examination, custody, damages. Defendant, exonerate, okay? If something exonerates you, it means it sets you free, okay? Ethics, equity, felony means a crime, a very serious crime. Fraud, court hearing, okay? Court hearing. You have hearsay, that means evidence that is hearsay, it means you don't have any concrete evidence, you only hear what people say, okay? That's hearsay. Immunity, okay? Innocent. Incarceration means imprisonment. Jail, justice, legal, legislation, manslaughter, murder, negligence, oath, objection, overrule. You have prosecute, revoke, you can revoke a decision. Testimony, warrant, witness, order, decree, due process, affidavit, aid and abet. Okay, these are some of the words that are often used in law courts. Now, when it comes to money and banking, okay, money and banking, you also have a whole lot of vocabulary used, okay, that forms registers. Now, here are some examples. Account, okay, you have an account with the bank, okay. Balance means the amount of money left in your account. Branch, the bank has so many other branches. Check, credit, current account, debit, deposit account, interest, loan, overdraft, okay? Overdraft, pay in, payee, pay in slip, statement, withdraw, collateral. Good. This is a very important word. If you want to obtain a loan from the bank asks you for a collateral, okay? The collateral could be your home or your car or anything that's worth the amount of money you need from the bank. Deposit, passbook, savings, banknotes, lender and investment, borrow, okay? You can borrow money from the bank. ATM, ATM means an automated teller machine, okay? Salary, bankruptcy, assets, liabilities, funds, income, revenue, subsidize. Treasury, valuables, teller, discount rate, overdrawn, bargain, capital, budget, deficit, down payment, earnings, exchange rate, mortgage, profit, loss, recession, bill de change, cashier, currency, debit or debt, foreign exchange, hard currency, transaction, bank hall or banking hall, counterfeit, bank manager, insurance, etc., etc., okay? So these are also words you can hear from the banking industry all the time. Now here comes an activity, okay? Now in this activity, you have a passage, okay? You have a passage, and in the passage you have numbered gaps. Now these numbered gaps indicate missing words, okay? So you are to choose the most appropriate option, okay? That is below the passage to fill the numbered gaps. Now, how do you do this? You have to read the passage and know from which area it is drawn from. Is it from banking, or is it from health, or is it from the law court, or what? So then you would know which words you should use in order to fill these spaces. Now it says, when my brother decided to dash a current account with the United Bank for Africa, he walked into one of its DAS and obtained the necessary DAS, which he completed and returned to the DAS. He was given pay-in DAS soon. He started issuing DAS to people with whom he transacted business. Whenever his signature was irregular, his check was not DAS. Once he wanted to obtain a dash, and the bank insisted on a dash. Now, we have 9 gaps there, which needs to be filled with the appropriate words. Okay. Now here are the options you have to choose. Okay. Number 1, if you want to answer that, you either choose start, open, begin, or close. Okay. Good. The same applies to number 2. You either choose branches, offices, premises, or house. Then up to number 9. Good. This is the correction of the first activity. Okay. So you check these answers against the answers you have. If you have any different answer, then you can change it. Or the first answer that is open, you open an account, you go to the branch, collect the forms, submit them to the managers. Then you have paying in slips. You start writing out checks to people. Then if the check is irregular or your signature is irregular, then they would decide not to pay the check. Then if you need to obtain a loan, then you have to give a collateral. Okay? Good. Now activity 2, the same thing here. Choose the appropriate option below to fill the numbered gaps in the passage. Now, the main DAS of malaria are regular DAS of high DAS. The DAS is caused by a DAS, which are carried by the DAS Anopheles mosquito. The mosquito is infected when it bites a man who is already carrying malaria parasites in his DAS. If the mosquito bites another person, after 2 weeks, the disease is immediately dashed to him. After about 10 days, the man experiences weakness, dash, fever, and sweating. Fever and sweating. In order to prevent malaria, mosquitoes must be dashed, and their dash grounds must be completely destroyed. Patients must be treated promptly, and people who travel to regions of malaria should take prophylactic dash to prevent dash. Okay? All right. Now, these are the options, okay, that you should use in order to fill those numbered gaps. So if you want to answer number 1, you either choose weaknesses, signals, symptoms, or signs. Number 2, grips, attacks, problems, disturbances. Okay. Number 3, you have pressure, tension, mood, fever. Disease for number 4, discomfort, plague, upset, and so on, up to the last one, that is number 13. Okay? So you read the passage carefully and choose the right word that fills that number gap. Good. So look at the corrections there. Okay? Symptoms. For number 1, you have attacks, fever, disease, parasites, female, blood, transmitted, headaches, eliminated, bleeding, treatment, and relapses. Okay. Okay. So that's the end of this lesson, and thanks for watching. Bye.